Hi, this is Dr. Andrea King. I'm the lead author in the paper Subjective Responses to Alcohol in the Development and Maintenance of Alcohol Use Disorder. This research is unique for several reasons. We conducted alcohol and placebo challenge testing in 190 young social drinkers, and we followed them for 10 years. We examined their alcohol use disorder symptoms and their drinking patterns over that decade. And we also re-examined the response to alcohol at the 5 and the 10-year juncture, achieving 91% of those eligible did come back and do those re-challenge sessions. So what did we find? Well, the positive effects of alcohol, the stimulation and the pleasurable effects, were higher in those who developed alcohol use disorder at the end of the decade. That was about 21% of the sample. And they showed initially higher positive responses to alcohol. And for stimulation and wanting, those effects magnified over time. So instead of decreasing over time, which some major theories would have purported, we saw actually an increase in those effects over time compared with persons who did not develop alcohol use disorder. We also conducted a complementary analysis whereby we looked at alcohol symptom count over the decade. The trajectory analysis showed that there were 3 groups that best described the sample, and those included those with high AUD symptom count, over 6 symptoms on average, an intermediate group at about 2 to 3 symptoms, and a low group that did not meet alcohol use disorder. And the results were largely the same, that the pleasurable and hedonic effects of alcohol were higher at initial testing in those highest trajectory groups, and those effects grew in intensity over time. These results challenge some prevailing theory and folklore about AUD in that persons are supposed to have a diminishment of these positive rewarding effects, and rather we found an increase. This may help us to understand more about the disorder and help to develop better and more effective treatments over time.